Thanks, Jim, and good morning to all the attendees. And thanks to Chris Jenkins from MMAC for managing the presentation, and Ali Namadi from our Institute for Health and Equity for providing the data analytics for my presentation. Chris, if we could go to slide 3, which is the first data slide. Starting from the top left-hand side of the slide, you can see that the daily numbers of new cases in Wisconsin still remain low, albeit there are preliminary indications of 3 unfavorable trends now. Daily case counts are beginning to rise in Wisconsin and in Milwaukee, as are the percentage of positive tests and the R value, which is a measure of contagiousness. These trends shouldn't be surprising because they've already begun to rise in at least 41 of our 56 states and territories. And typically this happens in concert with the emergence of the Delta variant. So looking at the bottom of the slide, Milwaukee shows similar trends to Wisconsin. Next slide, please. This slide shows continuing low numbers of deaths and hospitalizations, with mostly stable trends in Wisconsin and Milwaukee in terms of hospitalizations and deaths. This is good news for now, but recall that hospitalizations and deaths are lagging indicators that could and probably will change unfavorably rather quickly when the COVID-19 Delta variant of concern gains a foothold amongst the unvaccinated population in our state. Next slide, please. This slide gives a pictorial illustration of the progress that we've made in Wisconsin by reducing the current burden of newly diagnosed COVID-19 cases in each of our counties over the last 8 months. And what you see here are screenshots from our Department of Health Services website. Starting on the left, it's apparent that the burden of disease was critically high in 65 of our counties last November, as shown in red, and very high in the 7 remaining dark blue counties. And as you move to the right, you can observe that the burden of disease progressively diminished through early July of 2021, now with most of our counties with a medium burden of disease and 18 with a low burden of disease, shown as the 2 lightest shades of blue. So clearly there's been great progress to date, largely due to our early vaccination successes. However, further progress will depend on the balance between the emergence of the COVID-19 variant, especially variant of concern like Delta, and whether we can make meaningful continuing progress toward vaccinating the 50% of our population that remain unvaccinated. Next slide, please. This slide also shows 4 screenshots from the DHS website that show our COVID-19 vaccination progress. The left-hand panel show vaccination rates in Wisconsin, and the right-hand panel show vaccination rates in Milwaukee County. About 51% of Wisconsin citizens have received at least 1 dose of vaccine, and 48% have been fully vaccinated. Now, in terms of adults, 62% of Wisconsinites have received at least 1 dose, and about 59% have completed the series. Unfortunately, falling short of President Biden's goal of 70% of adults to be vaccinated by Independence Day. However, we are currently the best of the 33 states and territories that have not yet reached the 70% goal. Now, Milwaukee County shows similar numbers on the right. We're still lagging slightly behind the rest of Wisconsin, but are steadily closing the gap through focused efforts of groups such as Greater Milwaukee Committee, MMAC, Jump at the Sun, our public health departments, and coalitions of various healthcare, governmental, and community groups who are working very hard to address vaccine confidence. Next slide, please. This slide summarizes, next slide, please, Chris. Yeah, key data about worldwide vaccinations, where we stand as a country relative to the rest of the world, and where we stand in Wisconsin compared to other states and territories. So in the world, more than 3.44 billion COVID-19 vaccine doses have been administered. And the US is second in the world compared to the People's Republic of China for total vaccinations, 333 million versus 1.4 billion. And the US still has a higher percentage of individuals who've completed the series, about 48%, than most of the rest of the world. And you can see we're behind mostly small countries, but a few larger countries have caught up to us, and some have even passed us. So Malta's at 70%. You've got the UAE, Iceland, Bahrain, Chile, Aruba, Israel, Mongolia, Uruguay, Qatar, Hungary, the UK, and Curacao ahead of us. But relatively speaking, though, however, the US vaccinations really have started to lag significantly over the last 6 to 8 weeks, and it's clear that Canada will surpass us within the next few weeks as a percentage of population which has been fully vaccinated. And as I mentioned, Wisconsin is 24th of 56 states and territories in terms of percentage of fully vaccinated individuals. But over the last 2 months, we've progressively fallen back from our position as a top 10 leading state. And in terms of our neighbors, Minnesota and Illinois have surpassed us, although we remain slightly ahead of Michigan and Iowa. Now, this slide shows some key takeaways about the pandemic in the US. We have made significant progress against COVID-19 in the US, but our progress has stalled due to the Delta variant, and it appears to be reversing. The US 7-day average of new cases is now over 19,000, which is a 60% increase over the last 2 weeks. The US hospitalizations also are going up now at over 18,000, with an 11% increase over the last 2 weeks. But our daily deaths actually continue to decline. And remember, deaths are a lagging indicator, and we would not expect an uptick in deaths for somewhere between 4 to 6 weeks after the spike in new cases. Now, these unfavorable trends are most apparent in counties and states with relatively low vaccination rates. For example, in Missouri and Arkansas, which are seeing very significant surges now, but also across Florida and in Los Angeles. And the US is at 48% of the population fully vaccinated. Pretty remarkable when you think about it. 159 million people, or 55.9% of 12 and older, have been fully vaccinated, and 184 million have received at least one dose. But vaccinations are declining, and we continue to move forward very slowly. And our vaccine supply greatly exceeds the demand. And as a country, we did fall short of the hopeful target of vaccinating 70% of 18 years plus individuals by July 4th, although, as I mentioned, 23 states did reach that 70% goal. And our daily vaccinations in the US are down very significantly to about 600,000 per day. That's down 82% from the peak of 3.4 million in the middle of April. Now, the US has agreed to export hundreds of millions of doses to assist other countries that are lagging behind us, predominantly in Asia, the Pacific Rim, Africa, and South America. And that does matter to us because the pandemic won't be completely over in the US until it's completely over in the entire world. And with all the travel that's resuming, it's important that we reduce that burden of disease everywhere that we can. Next slide, please. This slide highlights the new World Health Organization nomenclature for COVID-19 variants. And on the right, it shows that there are 3 levels of recognized variants that are shown in that green bar. Variants of interest have specific markers that are predicted to, but haven't been clearly demonstrated to impact biology. The CDC is tracking 7 variants highlighted in blue at the bottom of the slide that are of concern. And these include epsilon, zeta, eta, theta, iota, kappa, and lambda. In contrast, WHO only recognizes 4 of those variants as variants of interest, and those are depicted by asterisks. Variants of concern, which are the ones that we should focus our attention on now, show clear evidence of increased transmission or virulence, or even partial escape from immunity. Both the WHO and the CDC recognize 4 variants of concern at this time, and these are termed alpha, beta, gamma, and delta. And you can see a little bit about each of these variants shown in the table below. Alpha was formerly called the UK variant. Beta was first spotted in South Africa, and these are still circulating widely in the world and are more contagious and probably more lethal than the variants that were circulating in mid-2020. Gamma, or the P1 variant, was first spotted in Brazil. And the one that is of most concern right now is one of the Indian variants, or the B1.617.2 Delta variant. The final category of variants that we would consider are called variants of consequence, and very fortunately, none of those have emerged yet. And those would be variants for which there's clear evidence that prevention or treatment measures are ineffective. Next slide, please. This slide shows some key points about the COVID-19 Delta variant, some things to consider. Delta is the most transmissible or contagious strain identified thus far. It's twice as infectious as the Alpha or Beta strains, which each were twice as infectious as previous strains. And these strains can be very easily spread by asymptomatic individuals, even fully vaccinated people that may not know that they've been infected. The R value, or the measure of contagiousness, is estimated to be 40 to 80% higher than COVID-19 strains that were circulating in 2020. So clear evidence that this strain is much more contagious. Also, the symptoms seem to have changed a bit compared to earlier in the pandemic. So the primary symptoms of Delta are headache, sneezing, runny nose, and sore throat, which are different from earlier variants, and certainly highly concerning due to the potential confusion with allergies or the common cold. And interestingly enough, the loss of sense of taste and smell don't seem to be primary manifestations of the Delta variant. Delta also appears to cause more severe disease with a more rapid onset than earlier variants, and the likelihood of hospitalization is significantly increased across all age groups. And based on what's happening in Missouri, might be of particular concern for us going forward for people in the 20s, 30s, and 40s, many of whom now are requiring intensive care unit care and even ventilator support in Missouri and Arkansas. We also know that Delta infects younger people, especially unvaccinated people, than other strains have previously been reported to infect. And Delta has shown partial escape from vaccine immunity. This is why the CDC strongly recommends that people should complete the full course of mRNA vaccines to achieve 90% protection. So the message is vaccination still works, but you need to complete the full course to get the full protection from the Delta. And now Delta comprises over half of the cases in the US. Only 83 cases have been detected in Wisconsin, but we expect within several weeks that Delta will be the predominant strain and that it will be driving increases in cases, hospitalizations, and ultimately deaths. Next slide, please. This slide and the next two cover some unresolved issues relevant to COVID. These are just posed as questions that I'd like to share with you. So should fully vaccinated individuals continue to wear masks? The WHO and the CDC have actually given different recommendations. Should children wear masks when returning to school this autumn? Now, recent CDC guidance says that vaccinated students and teachers do not need to wear masks indoors. I think there are many potential problems with this bifurcated approach, especially in middle school where some, but maybe not all the students would be eligible for COVID-19 vaccination. But the vaccination status of students and teachers might not be known to parents and teachers, and there may be a stigmatization effect. Will Delta cause another surge in the US? I think this is a very important question, as we know that 99% of the COVID-19 deaths in the USA since January have been in individuals that were not fully vaccinated against COVID-19. And I think we're already beginning to see that the answer is yes, Delta is going to cause a surge in the US. The question is, how severe will that be? And also a new emerging variant called the Lambda variant, which was first detected in Peru. Well, what do we know about that? Right now, there's insufficient data to designate this as a variant of concern, but based on the disease burden and the rapid spread in Peru, South America, and Central America, this is very likely to be designated as a variant of concern going forward. Next slide poses two questions. Will the US recommend a booster for people who've been fully vaccinated against either the mRNA vaccines or the J&J vaccines? We do know that Pfizer and Moderna will apply for EUA for a third dose, but currently there's not sufficient data to make an objective assessment about that. And I think you heard loud and clear from the CDC and the FDA yesterday that they want a broader amount of data, both from the drug companies and from clinical experience in populations before they're going to make that recommendation. And then will other countries recommend a booster dose? The answer there is yes. The 53 countries have ordered and administered Chinese vaccine doses. Fortunately, we have not had any here in the US, but the most widely distributed Chinese vaccines are based on a very old technology of chemical inactivation of virus particles. So the Sinovac and Sinopharm vaccines have clearly been shown to be weaker than other COVID-19 vaccines, especially when it comes to these variants of concern. So some countries already have decided to administer a third dose of the same vaccine or to cross-vaccinate with a viral vector or mRNA vaccines in individuals that have received some of these killed virus vaccines. Some of the countries include People's Republic of China, UAE, Bahrain, and I believe Indonesia and Thailand are expected to follow suit this week. So we can go to the next slide. I want to pose a final unresolved issue. It really is, what will the impact of Delta be in Wisconsin? So currently, as I said, there's low penetration of Delta in Wisconsin, but Delta clearly will be the predominant COVID-19 variant in Wisconsin by summer's end, possibly within weeks. Now, if vaccinations continue to be stalled here, our worst case scenario would be that we would have a similar surge in Missouri, which now has hospitals and ICUs full of severely ill young people with COVID-19. And this is especially apparent in tourist areas and rural serving hospitals in and around Springfield and Branson, which are concerned about being overwhelmed and have actually requested assistance from federal rapid medical response teams because the surge they're experiencing is much more significant than anything that they experienced in 2020. If, however, we continue to make some progress with vaccinations, I'd say our best case scenario would be what's happening right now in Israel, where fully vaccinated teachers are actually being infected by unvaccinated students, and where younger unvaccinated people are becoming symptomatically infected with Delta, but unlike in Missouri, without full hospitals or intensive care units as of yet, although monitoring the situation in Israel will be important for us. And then a final point that I want to make is about personal decisions about mitigation measures. These matter. They will impact the progression of COVID-19 in Wisconsin as Delta gains a foothold here. And then the next two slides, which I'm not going to discuss, are provided for your reference, and you can download the handout in the chat box. And these are about the comparative efficacy and characteristics of the 7 most widely distributed COVID-19 vaccines in the world, and also about the relative risks and benefits of COVID-19 vaccines and myocarditis, as well as some of the other rare side effects. And with that, I'll turn it back over to Jim, and if there's any time, I'd be pleased to answer questions.
Terrific. Thanks very much, Dr. Raymond. So Chris, let me bring you in here. Do we have some questions from the audience? We've got a few minutes here before our end time.
We sure do. We're seeing, Dr. Raymond, we're seeing some stories of people in the news who've been vaccinated, but yet contracting the Delta variant. And some people use this as proof that the vaccines don't work. Can you sort of maybe bat back at that misperception?
The vaccines work. Okay, let's just start there. With 99% of the people who have died since January from COVID-19 in the US were people that were not fully vaccinated for COVID-19. They're not perfect. You're not going to have an impenetrable force field around you that prevents the virus from you being exposed to the virus. That's why if you're in situations in which you have a high likelihood of being infected, if there's a high burden of disease in the community, your likelihood of getting infected goes up, even if you've been vaccinated. This is our best layer of protection, though, but there are others. Social distancing, wearing masks, considering not exposing yourself to high intensity, long exposures to lots and lots of people.
Thanks, Dr. Raymond. We also had a question about the current rates of vaccination. How long until we reach 70%, or can we at this current rate?
At the current rate, with the decline of vaccinations we're seeing in the US and in Wisconsin in terms of daily and weekly doses, we might not actually make it here in Wisconsin without a really strong push. And we're going to need that push to get up over 70%. And that means trying to address people that are questioning why they would get a vaccine, but are open to the possibility. People that are concerned that the vaccines are under emergency use authorization and not full approval, which quite honestly, at this point, I don't think that there is actually a meaningful and significant difference between the status. And I believe that the FDA is very likely to approve sometime this summer, both Moderna and Pfizer vaccines.
Thank you. We also had a question about the potential for vaccination of very young children, say a 5-year-old. Where does the FDA stand on that right now?
Yeah, this is a very difficult topic because we all love and care about our kids, And we want to make sure that if we're giving them a medication or a vaccine, that we know the risks and benefits. So it is true that COVID-19 is less likely to cause severe disease in young people. We know that. And that even bears out with Delta, although Delta is making kids sicker and it's infecting more kids. I think what I would say is that COVID-19 still can cause long COVID syndrome in young kids. Maybe as many as 50% of kids with COVID, even mild disease, have residual problems with brain fog and fatigue. We don't really know what the ultimate outcome is going to be. So that would be on the positive side of saying, yeah, I'm going to go ahead and get vaccinated. You know, the negative side really has to do with making sure that we have good clinical trials, phase 1, 2, and 3 that include kids. And we really won't have that information available until probably late August, when Pfizer and Moderna will release their studies in kids as young as 6 months. And we really won't know till then.
Thank you. We also had maybe one last question about the fully vaccinated teachers in Israel who you mentioned were infected by unvaccinated students. Do you have any sense of the outcome for them, how severe their disease was?
Yeah, early on, most of them were not particularly ill. Many of them became symptomatic though, which was, I think, a bit of a surprise. And very few were in the hospital except people that had pre-existing conditions or were over the age of 70. So the kind of things that you would expect based on the previous history with coronavirus, with Delta, which is sort of coronavirus amped up.
Great. Thank you for your time.
Thank you.
Thank you, Chris. Thank you, Dr. Raymond. Really appreciate your time and expertise, insightful as always. And also thanks to Todd Battle, Lafayette Crump for joining us earlier here on the webinar. And also last but certainly not least, thanks to everyone who attended the webinar here today. Just a reminder, replays of this episode and other episodes are available on MMAC's YouTube channel. Thanks again for attending and have a great day.